But you know what? The variants, they're going to be the lesson learned, right? When we don't take it seriously that we need to vaccinate the world, and we do this kind of ridiculous 20% thing, which is going to only create more mutations and variants, likely, that could start coming after kids, that could kind of fray at the edges of what we've seen or the contours of this virus. And, he sort of saw this irony or this poetic justice in this, that as we go to grab up all these vaccines could become completely useless.
This is the Public Health Insight Podcast. Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
In the previous episode, Gordon, LaShawn, and Will spoke with Julia Anderson, CEO of CanWaCH, the Canadian Partnership for Women and Children's Health, about her organization's work in global health, COVAX, and Canada's global pandemic response. In this second part of the discussion, Julia remains with us to talk about public polling, the importance of appropriately framing issues around Canadian foreign policy, and her career journey into international development and global health. This is where they left off.
I had a question, and Gordon kind of alluded to this earlier in terms of the importance of framing when it comes to advocating for foreign policy. And we were talking about kind of the self-interest language versus investment versus Canada's role. And CanWaCH commissioned a national survey on which was looking at the Canadian views on foreign aid spending. And what it said from that report, there's a section on framing, and it was talking about kind of the best way on how to frame these for Canadians. And some of the best kind of suggestions they had was to include stuff about the outcomes of Canada's contributions, the people they help, the specific problems that are being addressed, how our world is interconnected, and there's direct financial and health benefits for Canadians, for example. So when we're talking about galvanizing all these Canadians for their global support, why are these frames so important?
It's kind of simple, and then it's super contentious. So when we've polled, and you're right, and it's up on our website, CanWaCH has done quite a few. We polled throughout the pandemic, and we were polling before as well, on what's the best way to meet Canadians where they're at. We also just initiated or just completed this amazing process called, it was a deliberative democracy process with Stanford University, the Canadian International Council, and Global Canada. And it was fascinating. We were in conversation with over 400 Canadians, literally from coast to coast to coast. Like you'd look on a screen and you would just see the beautiful diversity that is Canada, regionally, ethnically, age, gender, and anyways, it was a fascinating process, and we got to ask them questions about their perspectives on foreign policy from a global health and an equity perspective. So when you put that together with our polling, and I'm not allowed to share the results of foreign policy by Canadians yet, but I can say that it's to a degree, it's consistent with our polling. Canadians believe that they have a moral obligation to show up in the world, and we have cover for that. Canadians don't understand the ways in which we are showing up in the world, so they're unaware of the ways that we're showing up in the world. And Canadians are also somewhat unaware of the degree to which their well-being, their ability to thrive in this world, to exercise economic choices, to get jobs, etc., how tied up those interests are with people around the world. So there's a lack of understanding about that. So when you're looking at it from a public engagement or communications perspective, you kind of have to use one of those as your entry points. You kind of have to help people understand the problem before you just get to by the way, Canada should spend more on development assistance. Like that, it doesn't mean anything to someone. You have to start from the beginning, where Canada exists in the world and things are really bad in certain places. They are dramatically different than here in Canada. And I think we've kind of got this watered down notion of some of the existing misery of poverty around the world as maybe we become desensitized. I don't know why. Maybe we become desensitized, but we have a bit of a notion that things are just as bad in Canada, and that is fundamentally not the case. Like that is just, there are terrible things and inequities in Canada Absolutely. Is the Canadian government 100% responsible for dealing with that? Absolutely. Yes. Yes, yes, yes. And around the world, things are dramatically worse, right? And I think, and does Canada have a role to play? So you've got to start there. For some Canadians, this self-interest argument really works, right? This argument that your ability to have your morning coffee, it doesn't grow in Canada. Coffee does not grow in Canada. Your ability to enjoy your Tim Hortons, your whatever, is linked to a worker somewhere else and their ability to get to work, to plant seeds sustainably, all these things, right? So it's not this like self-interest that is so crude and, you know, and sort of dark and whatever. It's a self-interest that just links our existence as humans together on the planet and the kind of economic system and all this stuff. So my perspective, which is not shared by everyone in this sector, is that we need to make all the arguments. We need to say all the things. We need to meet people where they're at, lay out a problem from many different angles, and then start to propose what we see as some of the solutions, including what they can do about it. So I don't believe that the moral argument is the only argument. I don't believe that the self-interest argument is the only argument. And I don't believe that either of those arguments are perfect or without their various, you know, negative iterations and tentacles, and that we have to be careful of all those things. So yes, we have to be careful to talk about aid in a certain way. Yes, we have to talk about equity and center our work on equity, and that matters, but we can still have conversations that meet Canadians where they're at from my perspective.
Yeah, and that's a good one too. And real quickly, like the world is interconnected. Sure, we can get all 100% of Canadians vaccinated, for example, and then if you want to take a vacation to Hawaii and they're not vaccinated there, you can't go to Hawaii. So sure, it's you're protected in Canada, but if you want it, the world is interconnected. There's a lot of leisures and privileges we are afforded that depends on other countries also being in a good position. So we must never forget that.
Absolutely.
Yeah, and I mean, the kind of ultimate, I was talking to a friend who's just deeply frustrated by the grab, you know, the rich country kind of grab at vaccines. And we get it, we're democracies, you know, but sometimes it's disheartening, it's tiring to think about the way that played out, like just this nationalistic, that essentially the ACT didn't work exactly in the way that we wanted. So we were kind of having this conversation about, just how challenging that landscape is and whatnot. And he said, but you know what? The variants, they're going to be the lesson learned, right? When we don't take it seriously that we need to vaccinate the world, and we do this kind of ridiculous 20% thing, which is going to only create more mutations and variants, likely, that could start coming after kids, that could kind of fray at the edges of what we've seen or the contours of this virus. And, you know, he sort of saw this irony or this poetic justice in this, that as we go to grab up all these vaccines could become completely useless. So rather dark way of thinking, rather kind of a way of thinking that you don't want to spend too much time stewing over there. But I do think that the point is clear, right? Like, we're not saying vaccinate everywhere because you're not safe unless everyone's safe for fun. It is true. And it is scientifically being demonstrated and playing out in a very dramatic way that is going to cost lives of Canadians and of people around the world.
Yeah, so you mentioned, and just to wrap up the COVAX, you know, the vaccine distribution, vaccine equity part of our conversation, you'd mentioned the challenges around intellectual property and what unlocking what that could do for a global response to COVID-19. So I was wondering if you could talk more specifically about what the TRIPS agreement is and what are the arguments for by, you know, whether the stakeholders involved, the arguments for and against activating the TRIPS waiver.
And this is where I get into, well, I'm often in a space where I'm not an expert. So I love to kind of ask questions, and my curiosity has given me a bit of a knowledge, but sometimes that can be dangerous. So I'm open if we've got any students of intellectual property and the WTO. Please correct me if I'm wrong. But I mean, this is one. The TRIPS waiver essentially sets out the rules by which we sort of engage in global production of assets and goods. And what the TRIPS waiver, which is being demanded by pretty much every low and middle income country, is on that list who wants the TRIPS waiver, and pretty much every high income country has some sort of agreement, I don't know, behind closed doors, it feels like some sort of gentleman's handshake that they will not sign on to the TRIPS waiver. And if you look at the map, if you ever wanted to see like the post-colonial or the colonial world playing out, look at the map of the countries who want the TRIPS waiver and the countries who don't, or who are neutral or undecided. But essentially what it would allow countries to do is treat anything related to COVID, so all those commodities that we talked about earlier, as a public good. So, or that it's needed for the public good. So that would mean that companies, all that manufacturing capacity that I talked about, the latent, sitting there, sleeping, manufacturing capacity would be able to be engaged in a much quicker way. Right now, individual countries can activate it, but they have to go through a whole process, and it's not been used, it's not been well used. This would just give a blanket. No. If it's about masks that will protect you from COVID, if it is about ventilators that will be part of diagnostics, or if it's a part of, therapeutics, or if it's a part of vaccines, the IP is shared and open. So Canada right now has not said no, but has not said yes, and is being somewhat obstructive. So they're asking questions like the way that you do if you're trying to stall something. They're throwing questions out into the world. So we would like Canada to either get out of the way or ideally sign on. I think it's coming in the States. I don't think you're going to have a Biden administration that doesn't, unless there's some third way that kind of gets developed, which WTO is talking about. I think you're going to see, there's been some lobbying. I think you're going to see a bold action on the part of the US administration. I think it'd be a little bit embarrassing if our previously super bold feminist government was a taker on that policy, not a driver, right? So why let's be the first developing country that takes sort of systemic racism seriously and says, nope, this is a way to localize solutions. This is a way to let countries lead their, create their path out of COVID. And it's just smart. So I'm hopeful that we can get somewhere with this government that has, and it wouldn't cost us anything. That's the other thing.
Right. Yeah, I just had a quick question following up what Julia said about the TRIPS. So it makes so much sense that these countries would want to, I guess, sign on to it, and kind of going back to our earlier points of you're not safe until we're all safe kind of mentality and equity and all that lens. But so it's I'm struggling to grasp my mind around what's kind of the argument against it. Why is there so much contention? Is it purely because it's their intellectual property, they don't want to share it, or what's the deal there, kind of from your perspective? Yeah,
I mean, this is the question I ask every smart person that's dealing with this. It's a real head scratcher. It is a real head scratcher, and the only kind of reasonable reason is that there's money to be made. And regardless, irrespective of the fact that it has been primarily public investment in these vaccines, so therefore they should be a public good. So we paid for them as a public, put a ton of money into research, and therefore, sure, I don't care if AstraZeneca or Pfizer makes some money on this, fine. But do they really have to take their profit margins from 80% to 110%? If that means that, if that's the difference between sharing the technology or not. And so it is profit. It is 100% profit. That's the only reason. Then the kind of secondary interest that is at play there is if you as a country have deals with all these pharmaceutical companies, there's an incredible amount of pressure in order to, stay in the favor of these pharmaceutical companies, which your population is 100% dependent on. There's a lot of pressure to not sign the thing. So it's kind of thought of as bad for business, although it wouldn't be bad for all business, because all those manufacturing facilities, all those jobs that could be distributed around the world would be at play. But it's bad for certain big business. And so that particular big business at this moment has a lot of, has a lot of power, has the power. I'm hesitant to say, although I do feel like they have as much power as national governments at this point to really shape the outcomes of the world. And that, that's a scary thing for those who believe in democracy and all these kinds of things. So we're hopeful that we can get the Canadian government to stand up and be bold. But I would love to peel back the curtain and really understand with more depth, aside from those kind of high level, what it looks like. Like, is it Pfizer calling Deputy Prime Minister Freeland and being like, don't do it, don't sign it? Like, what kind of pressure? Like, that would be a fascinating PhD to do someday down the road.
Imagine a movie being made on this, in the future.
Totally,
so cool.
Totally. It's got all the elements of palace intrigue, unless there's something big that I'm missing, but I don't think so. I think that's it. Pressure from people with power.
Are there any oppositional arguments towards coming from other organizations? And if so, what are they? And this is related to the ACT and the CanWaCH initiatives.
No, I don't think so. I mean, I think that there's a broad recognition and investment, and there has been investment that has followed in the need for global vaccine distribution. No one argues that we've got to get a vaccine out to the world. I think some of the opposition comes in the how. What's the best way to do that? What's the fastest way to do that? And organizations are definitely very divided on that, right? And questions like when you go in to strengthen a health system in order to get a vaccine distributed, are you taking a health systems approach, or are you taking the piece of the health system, the silo of the health system that is going to deliver on this particular thing? So many organizations, like colleagues at Nutrition International, would say, if people don't have good nutrition, they don't have health systems that provide for adequate nutrition, the vaccine is less effective. The vaccine, people are going to die at a higher rate. Like, we need to address this. So I think there's lots of disagreement and kind of good constructive argument about how you build the system that works the fastest. But I don't think that there's major opposition to the idea of, a coordinated body that's going to help us think through this. And all of the big actors, as I think LaShawn said earlier, are at the table around the ACT broadly.
One thing that comes to mind is the tragedy of commons, where when you build a system, if it is to work the way it's intended, you need buy-in from all the big players that are involved in the global stage, so that they don't make those bilateral deals with manufacturers and circumvent the system, and then rendering a lot of it obsolete. You mentioned there's a big funding gap there. That probably has something to do with it. If you're outside of the CanWaCH ecosystem, you're less likely to be involved with that second AMC stream to provide some funds there. And then providing funds when there's no vaccine available is also not helpful if you've dried up the market. You mentioned it's purely the buying power and pooling resources. So then you pool the resources and there's no vaccines to buy from. That's also counterproductive. So you touched on all those things. It just had me thinking, like, systems only work if they're being used the way it was constructed, and then everything can just fall down if you have big players like the US and other countries that are not in it from the get-go.
Yeah, and I think there's a big moral question too there about diversion. So, we saw in Italy and we saw in certain countries where health systems stopped working for everything but COVID. And so, for anyone who has, like me, had a relative with cancer during this period, or any serious health concern, Are you comfortable with your health resources and systems being diverted 100% to COVID? Of course not, because that person needs the care, the immediate care. But around the world, when systems are weak and when they're not well resourced, those choices are choices. Are we going to vaccinate people for COVID? Or are we going to vaccinate against TB? Are we going to vaccinate against smallpox? And yeah, I think that's a really important moral question that we have to ask when we're thinking with a mindset of finite resources. And I think I would challenge us to break that mindset for sure.
One of the questions that I've been thinking and just been exposed to through work is like the idea that the COVAX facility lacks to a certain degree of transparency in the process, right? It's like how are the shipments prioritized? Like what's like the real behind the scenes kind of mechanisms and controls and just I guess governance structure it's in place for the allocation to be made. I think that's I think that's a very dangerous grounds for politicization and really just turning this what's supposed to be a very technical and collective kind of mechanism and structure into like a muddy and messy place of politics.
Yeah, I think so. And the transparency issue is definitely has been taken up by civil society. My quick comment on it is I trust many of the players at the table to take a non-political and smart approach. I think they need to make transparency the goal because it's a non-democratic space, right? And it unlike like some of the spaces within are democratic spaces, but it's a non-democratic space. But I trust them to make smart decisions. I do not trust them to move quickly. They're heavy and big bureaucracies. And so when I was kind of in that early advocacy for civil society to be a part of things or not, I got just a churning feeling in my stomach because I'm like, I want to argue that we should all be there and that transparency should be the number one thing, but I also need them to move faster than they've ever moved before. Mm-hmm. And so in as much as that's a trade-off, I erred on the side of the just go fast, but it does, scholars would argue it doesn't have to be a trade-off.
I felt like I knew a lot about the COVAX and TRIPS waiver, but I think you can never know enough. So I know after this, I'm going to dig into it a little bit deeper to learn about some of the pitfalls and the advantages of doing it. So thanks for enlightening us with that conversation. However, as a significant portion of our audience are students and early career professionals, many of them have been inspired to enter the field of global health during these unprecedented times. And given that we have you here with your wealth of leadership experience and subject matter expertise and your inspiring career journey, we'd be remiss if we didn't get a chance to ask you about your journey into where you are now, some of those career options in international development that a typical student may not be aware of. So we can start off by, how you got, you talked a little bit about how you got interested in international development, but if you could just talk us through your journey to discovering through your various roles that you've had and ended up where you are now.
Yeah, absolutely. So the first piece of advice, which kind of frames out my career story that I give to people interested in one thing who are passionate about one thing, is that your career can take you in a lot of places that seem like a weird fit for that thing. And that's okay. Take what you can and learn, maximize every opportunity wherever you are, even if it's at Starbucks. And that's where you are at that moment. Can you get managerial experience? Or can you get whatever it is, see yourself as a sponge for transferable skills and learn how to spin your transferable skills, which is, I think, one thing that I learned and was taught and was able to do to some extent in order to jump around in my career. So I started out on a kind of internship type thing with a small organization called Jamaican Self-Help. It was a Canadian-based human rights organization that worked in Jamaica and the Caribbean. And so I started working with youth and policy issues, and we were, so much like I'm doing now, we were advocates for the Make Poverty History campaign and for a variety of things. And then having been a receiver of government funding I worked there almost 5 years, I wanted to go sort of peel back the curtain. I don't know if I was that strategic at the time, but that's how I describe it now. I think I also just needed to make some money. So I went and worked for government at a granting agency. And then I had a really unique opportunity to work as the director of human rights at a university, which was essentially taking human rights complaints. I don't know if you've engaged with, which I thought was something very different. And when I got into the job, realized what it was. And it was this kind of fascinating experience to actually be working within the legal limitations and opportunities of the human rights system. And during that whole time, I was sitting on boards of directors and, always kept my foot in the door on international development issues through volunteer work. And that's how I kept the motivation up, and then landed at CanWaCH about 5 years ago. And have taken a variety of roles. So I can, and you hear people that are kind of like, I would call myself, I just turned 39. I would call myself like mid-career. I hope I'm mid-career. I hope I have many more years of working. And you hear people and their story sounds like it makes so much sense, but it really didn't make sense when it was happening. And there was all these personal reasons. I needed to stay in Peterborough where I live. I needed to I had a daughter through that whole process. I had her when I was 19. So the kind of normal trajectory for an international development student was not available to me. And so I had to kind of grind through in this different path. But everyone I talked to who's were kind of, in my same age bracket, they felt that way too. And I was like, I thought it was just me and my specific circumstances. Everyone's taking jobs and doing things that doesn't quite fit. I encourage that as a strategy rather than as something you feel you're kind of caged into.
Right. And the important lesson learned from there is a lot of people might end up in a job or a certain career field that they're not as interested in. They're a little bummed out that it's not their ideal thing. But what you're saying is, as much as that might not be where you want to be at that moment, try to pull out those transferable skills that will get you to where you want to be. And I think that's something that even in our conversation with students, they look at the end goal rather than the process of getting to the end goal. And I think that approach is very helpful.
Sometimes the issues we discussed can feel too out of hand for an everyday person. How can we help engage others to help such issues?
Yeah, I think that's a really great question. I think it depends who those others are and where they're at. So I really encourage people to take your convictions to the dinner table, which for me, in my broader family, has been at times a real challenge, because I deal with issues like sexual health and reproductive rights that do not resonate with my family in a yay for you that you're working on these issues sort of way with a lot of my family. And so I encourage everyone to sort of take your issues to the dinner table and have the conversations, right? Like, we need to commit ourselves to difficult conversations. And sometimes the desire to drive action skips us over that part where we have the conversation. So it's easy enough to sign a petition, to give $5 to, do something and be like, okay, I've done it. And what we've seen with everything from, issues of Black Lives Matter and systemic racism to the Me Too movement is that we're missing the part and the instinct and the skills to have the conversations. So my biggest encouragement to you is to just practice having conversations with people about these issues. And even if you're not the expert, being curious, what are do they think Canada should be doing something around the world? Do they hear about, what's going on right now in India? What do you think of this, right? And see where those conversations take you. And then from there, there's a plethora of actions you can take. We've got great members. You can check out on the CanWaCH website, where there's everything from engaging in campaigns to engaging in, donations, volunteerism, all that kind of stuff. But to me, and this is why I was really passionate about the Foreign Policy by Canadians project, we need to learn how to have conversations again about tough topics, that we need to complexify, stop trying to simplify everything and get comfortable with the messy complexity of the world we live in.
What is the best way to use LinkedIn for career connections?
Oh, I'm so bad at LinkedIn.
Yeah. Or broadly. What would you say just broadly?
Yeah, I love LinkedIn, but I'm so bad at it. Yeah, I mean, I would say networking more broadly, come with a specific question. So the kind of generalized networking that's like, hey, I want to get to know you. That's great. I might add you to my LinkedIn. Fine. But if you're actually purposefully seeking out, I want to grow my network of people that are working in Canada on global health issues, and you send me that message and say, look, I'm really trying to understand this landscape for this reason, and this is my personal interest in it, you're going to get a lot better of a response. So random networking, as much as it's fun, is not, I don't think, it doesn't turn heads in the way that you want to turn heads. And to get that, and you don't need to, going big is not helpful. Having a few key connections who are willing to work with you, a few key mentors, I think is a lot more helpful.
Fantastic. Yeah. Purposeful and targeting networking. As someone with an interest in global health, I often find myself conflicted with how global health as a whole is conducted. For example, it can be paternalistic, neo-colonial. How do you manage this conflict either internally or within your organization and colleagues?
Answering that quickly is a challenge.
Very true.
We keep our head up about how very true your statement is, and we're actively looking for ways and to build best practices and to push our members hard. We push hard on kind of this equity-centered, human rights-centered, feminist approach to global health that we think will fundamentally revolutionize and challenge a lot of the kind of, the really colonial, negative, racist realities of the way global health plays out right now. So I'm with you on the conflict. I'm with you on the challenge, and I think it's our job at CanWaCH to push not kind of, but hard on these issues to make it better.
We have a lot of aspiring women public health professionals in our audience, and there are countless reports such as the 2020 Global Health 50-50 report that highlights a lack of gender equity and gender inequality and diversity in leadership and senior management positions. And so one of the quotes from that report, confronting the 70, 80, 90 glass border in global health. So more than 70% of our leaders in our sample are men, 80% of our nationals of high-income countries, and 90% were educated in high-income countries. Given that you're the CEO of CanWaCH and have had a very interesting career path, as we all heard, do you have any tips or advice to these women who often have to face countless barriers in their workplace, among other places? And what are some things that workplaces can do to ensure gender equity and diversity in leadership?
Yeah, I mean, I think so. We're doing a ton of work on confronting patriarchal systems that create space for men and not women. I think as the leader of this organization, I've forced myself and literally invite myself, which I did this week, into spaces that are held and occupied by men, and I set myself up for the challenge of those spaces through, literally meditating in advance of them, to go into an all male space where everyone is more credentialed, often older than me and things like that. I have to set myself up, and I try to create those protections for my staff as well. We happen to be an all-female team at CanWaCH at this moment. And, we try to talk about kind of the personal side of that. And then we try to force ourselves into spaces and change the look and feel of spaces that are traditionally held by men. I think, where we're having conversations right now is about race and diversity, and we're really challenging ourselves. And I'm situate myself as a very privileged and white woman who's come into this space with a whole host of privileges. So I'm really have been challenged to think about how to create, as a leader, what it means as a leader to create an anti-racist space and to elevate voices. It is my commitment and my life's work. And I do not have the answers to this question to sufficiently, it's a bit of a head scratcher for me when I look around at the brilliant women that exist, and gender diverse people that exist on this planet. And I go, why is there still this wage gap? Why is there still and then I walk into one of these meetings and I feel it. I feel all the whys play out in my own physical experience. So that's the shortest answer I can give.
Yeah, thanks for sharing that. From having this conversation, Julia, what are one or two key takeaways in a broad sense that you want each of us listening to take away from this discussion?
I think just be encouraged that we're having the conversation. And I'm really grateful to the three of you for the podcast, for facilitating these conversations. I'm grateful to everyone who showed up and is asking questions. And I just, the takeaway is let's do more. Let's do more of this kind of thing. And let's get people who are not me into this space and having these conversations. And please do, for those listening or engaging, reach out. I'm not always the best at getting back to people right away and engaging, but I am interested in your story, what you're passionate about, what's driving you to show up and listen to the podcast. So if you want to share that with me, maybe we can try to get a conversation going.
Absolutely. Well, back to you as well. Thank you for talking to us, enlightening us as the podcast host, as well as the our audience on all corners of the world that took time out of their Saturday morning to learn from your expertise and your knowledge and your experience in the area of global health and international development. So we would like to thank you for taking the time and sharing your knowledge with us.
Thank you so much, Julia.
Thank you very much.
Thanks for having me.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.